From Ohio, Ms. Brown is now recognized for questions.
Thank you, Chairwoman Maloney and Ranking Member Comer, for holding this hearing. It is important to acknowledge that abortion bans and restrictions do not affect all people equally. Ms. Graves, can you explain how abortion bans and restrictions impact women of color in particular?
So women of color are disproportionately residing in the states that are banning abortion. So that's the first thing to think about. But even if you go beyond there, right now you're going to have sort of two different situations. It is either that people are going to be able to get access to medication abortion, or they're going to be able to travel. Each of those things put additional hurdles that are going to come down on people very, very differently. It's not a small idea to just pick up and travel to get your own health care. It requires you to take time off, which women of color are less likely to have. It might require you to arrange childcare for the children you already have. But the last point is that we should not be confused about the criminal penalties that are going to come to not just providers, but to people who are seeking care and anyone who helps them. The states around the country are not saying the things that I have heard today in this hearing room about how there won't be any criminal punishment. They're saying the exact opposite and passing laws with many, many years of criminal punishment attachment.
Thank you. As you explained when we discussed the health impacts of abortion restrictions, we must also address the structural racism faced by people of color in our medical system. Across the United States, communities of color experience systemic health disparities, including higher rates of uninsurance and stigma. Maternal health outcomes are also directly correlated with race. As we've heard a number of times in this hearing, Black women are 3 to 4 times more likely to die in childbirth than if you're in Mississippi. That's exponentially higher. Ms. Graves, how do laws that force people to continue their pregnancies present unique health threats to people of color?
Well, you have to start with the fact that, as you name, the access that people of color have to health care, just full stop. Right now, healthcare isn't readily available in every community. People aren't always covered in terms of insurance. Not every state has expanded Medicaid to meet the needs of the lowest income folks. So we already are in a situation where healthcare access is worse. And so if you are choosing, if you don't have an ability to decide whether or not you terminate a pregnancy on your own terms, what we know from the studies is that it is likely to have worse health and potentially life outcomes for that person. That's going to disproportionately affect people of color who already have less access to health care.
And I think it's also important to note that many minimum wage workers are women, and especially, specifically women of color, a disparity this committee has taken on as it is working to address. But for people with less income, the cost associated with abortion care, which you touched on, includes the cost of the procedure itself, transportation costs, child care, and taking days off from work, already pose barriers to receiving it. State restrictions that force pregnant people to travel long distances to see a provider make abortion care even more unaffordable. Representative Shannon, how will the ripple effect of abortion's ban on access to other reproductive health services particularly impact people of color?
Well, as I mentioned before in my initial testimony, outlawing abortion would basically amount to that folks who have resources would be able to get access to care, which we know that Black and brown folks are disproportionately represented in the number of folks who make minimum wage throughout the country. So it's going to boil down to, do you have the financial resources? Do you have child care? Do you have the wherewithal to be able to travel to another state to get care, potentially have to stay, for a period of time? And so all of these things are things that folks of color would be less likely to be able to access.
Thank you. So I think it's pretty clear people of color already face racial and ethnic disparities related to other health outcomes from diabetes to cardiovascular disease and breast cancer. Draconian abortion bans and restrictions that force people to remain pregnant further entrench the health disparities faced by communities of color. So it is my feeling, it is our moral obligation to do whatever we can to lift up historically marginalized communities that look like me, and this includes protecting and expanding abortion access. So with that, every person deserves the opportunity to make their own decisions about their body and their future. And with that, I yield back.